Your Honor, the state's next witness will be Christopher Sanchez.
Mr. Sanchez, I'm just going to confirm you were sworn in, correct? I know I swore in a lot of people at once, so I just wanted to make sure. Thank you. You may proceed.
Sir, please state your name for the record.
Chris Sanchez,
And Mr. Sanchez, where are you employed?
Artesia General Hospital.
In what capacity are you employed with the Artesia General Hospital?
I am a registered nurse in the ER.
Mr. Sanchez, were you working on January 27th of 2023?
I'm assuming that's the night that we're here for, and yes, but I don't know what date that was. Sorry.
You're unsure?
I'm unsure of the date.
Okay.
Yes.
So I'm going to take you back to a date in January. Were you on shift and there was an incident that required law enforcement to come out and investigate?
Yes, I was.
Was that situation regarding a newborn infant?
Yes, ma'am.
What, I know you said you were an RN in the emergency room. On this date, did you have a specific task or area that you were assigned in the ER?
Yes, I did.
What was that?
I believe I had rooms 2, 4, and trauma 2.
It was 2, 4, and trauma 2. And so how do you get assigned, or when you come to work that day, is that already designated for you? Or
It's designated, yeah.
on that date, Mr. Sanchez, did you interact with an individual named Alexee Trevizo?
Yes, I did.
And was she in one of the rooms that you were assigned?
Yes, ma'am.
Do you see Ms. Trevizo in the courtroom today?
Yes, I do.
Can you point her out or describe what she's wearing for the court, please?
Yes, she's wearing blue coveralls and glasses, black hair.
Does the record reflect that the witnesses identified the defendant, Alexee Trevizo?
The court will note that the witness has identified the defendant, Alexee Trevizo.
Mr. Sanchez, do you know if you were the first person in the emergency room to make contact with the defendant that day?
Possibly the first nurse. I believe I pulled her into the triage room.
Possibly the first nurse who pulled into triage. What's triage?
I'm sorry?
What's triage?
What's triage? It's just a room to designate acuities of the patient and kind of to do an introduction, vitals, and then get her into an emergency room in the back.
It's a step before getting
Yes,
her
ma'am.
into a patient room. And what was the defendant there for?
I believe it was back.
Your Honor, I'd like my continuing objection.
Noted.
Thank you.
Overruled.
I believe it was for back pain, lower back pain.
And so, you said earlier the triage rooms for vitals and things of that nature. Did you get all of those things done on the defendant?
I possibly did. I honestly do not remember if we were able to obtain all of the vitals in that room or if we got them in room 2, which is where I placed her.
Okay, so you either got them in the triage room or in room 2?
Yes, ma'am.
But you're not sure which?
Correct.
Okay, I understand. Mr. Sanchez, was anything else reported to you other than the lower back pain?
Not that I recall.
Sorry, I should have clarified that. Any of the medical issues that were reported?
Not that I recall.
two?
I'm not sure what you mean.
I can rephrase. Did the defendant ever leave room two?
Yes, she did.
Okay. Where did she go?
To use the restroom.
What restroom did she go use?
The ER patient designated restroom.
So in the emergency room in the Artesia, is there, in the patient room, in room two, is there a separate bathroom in room two, or is it in another area of the emergency room?
It's in another area.
Can you describe where, in reference to room two?
It's almost directly down a straight hallway, but there is a slight curve. It's just right down the hallway.
And you said that this is an ER patient designated restroom. So does this mean that can members of the public use this? I mean, rephrase that. Members who are not in the ER use that bathroom?
Visitors will also use that restroom.
Visitors will?
Visitors with patients.
Okay, visitors with patients.
Yes.
So the defendant had to use the patient bathroom. Was there any issue at that point that you saw or anyone else saw with her going to use the bathroom?
No, ma'am.
Did an issue arise once the defendant had gone to the bathroom?
Yes.
What was that?
So the ER doctor wanted to examine the patient, and she had been in there for an extended period of time. So I went to check on her, and several times, and she said she was coming out, but remained in there for a bit longer until I asked for our clerk to get the keys to unlock the door, and then she finally came out of the restroom.
Okay, so doctor wanted to examine her, and you said the defendant had been in there for an extended period of time. Can you give us an estimate or a description, best you can, as to what you mean by extended period of time?
Maybe 15, 20 minutes or so until...
Before the clerk came with the key?
Before I went to check on her, and maybe about, yeah.
I'm going to show you just a still of what's been entered as State's Exhibit 1. This is 2621. Is this you depicted in the still? Can you see? And if you can get up and look if you need to.
That is fine.
It looks like...
Mr. Alexee, lean back again. Thank you.
Yes, it looks like, yes.
And in this still, can you see where the ER patient bathroom is?
Yes, it would be directly over my left shoulder, near the fire extinguisher on the wall.
Directly over your left shoulder, you said near the fire extinguisher on the wall?
Yes.
Okay. Is there anything else near the door other than the fire extinguisher?
There's a drinking fountain.
So this area here.
Yes, ma'am.
And is this the bathroom that the defendant was in?
Yes, ma'am.
So you said you checked on the defendant multiple times. You said she was coming. Were there ever anything that you heard that caused you to think that the defendant needed help or assistance?
I just heard the paper towel dispenser dispensing paper towels several times. I don't know how many times, but it was more than I would expect a normal person would need to wash their hands.
So that was the only sound that was...
Yes, ma'am. That was the only sound.
So when the defendant came out of the bathroom, where did she go?
She walked directly back to her room, bed 2.
Did you notice anything about her that was different when she walked out of the bathroom?
No, I don't believe so.
Was anything reported to you by the defendant when she walked out of the bathroom?
I asked the patient what had happened because I saw the bathroom when she opened the door, and I asked her what happened, and she says, "I'm on my period." That was the only thing she reported.
What prompted you to ask what happened?
There was a large amount of blood on the floor and the wall behind the toilet.
Or behind the toilet in the ER patient bathroom?
Yes, ma'am.
Your Honor, if I may approach the witness and post report, this states Exhibit 2 for purposes of identification.
I've seen it.
Mr. Sanchez, do you recognize this photograph?
Yes, ma'am, I do.
Okay. And what is depicted in this photograph?
It appears to be the restroom, the patient restroom in the ER department.
And does this photograph accurately depict what you just described to us as blood being on the floor, on the walls?
Yes, ma'am.
And this was after the defendant exited the bathroom?
Yes, ma'am.
Does it look to have been altered or changed in any way that you saw it that day?
Not that I can recall. It was...
Your Honor, I'd like to admit State's Exhibit 2 as evidence.
Just my usual objection, but otherwise none.
No, objection is noted. State's Exhibit 2 is admitted into evidence.
So, Mr. Sanchez, to your knowledge, did this bathroom, was it in this state prior to the defendant going in?
To my knowledge, no, it was not.
There is something that's on the wall in that photograph that has a long string coming out of the bottom. And I can, if you need the photograph again, I can get that to you.
The call light, it would be a blue string. Patients pull it to if they need assistance.
Okay. So you said it's a call light?
It activates the light outside of the restroom if they pull that string.
So it's a box with a long blue string, and you said patients pull it and it'll turn on that light outside of the bathroom?
Yes, ma'am.
Does it alert anything, any other way other than turning on that light?
Yes, there is a bell or a chime that lets the staff know that someone needs assistance.
While you were, well, the defendant was in the bathroom, did that light or chime ever get activated?
The light never went on and the chime never went off. No, ma'am.
So, Mr. Jones, when you see the bathroom in this state, did you go inside to inspect further?
Yes, ma'am, I did.
And what did you inspect when you went inside of the bathroom?
I looked into the toilet and also looked into the trash liner.
Okay. And did you see anything in the toilet?
No, not that I recall.
And you said you looked into the trash liner. Did you see anything in the trash liner?
No, ma'am.
There's a trash can depicted in State's Exhibit 2. Is that the only trash can that was located in that bathroom?
Yes, ma'am.
So, once you looked at that, you about the defendant's answer about why the bathroom was in that state. What did you do from there?
I don't recall exactly. I would have most likely went back to the nursing station and let the physician know that there had been a large amount of blood in the restroom.
Or the amount of blood?
Yes.
Just as a matter of course, if your facility anywhere, the bathroom, the hall, patient room, do you leave it in that state, or do you usually call someone to come in?
We call, they call them EBS, it's Environmental Services, and they come in. They'll get a deep clean.
I'm referring back to the still frame in States Exhibit 1. Can you see where the nurse's station is located in this?
Yes, ma'am.
Where is it located?
The way that I am facing, right around that corner.
Right around that corner. So there, it looks as though someone or something red is there in the bottom right-hand corner of the still. Can you see that? I'm so sorry.
Yeah, I can't make out what that red is, though, but yes.
But is that the direction that you're
Yes, ma'am.
Okay. Just, so you said in the trash can, there was nothing that you saw inside of it. Does that mean nothing of concern or nothing at all?
I don't recall it having anything in the trash liner.
So not even any trash?
Correct.
Was this the last contact that you had with the bathroom in reference to the defendant?
I believe so, yes.
You didn't go in there again after inspecting the bathroom?
I don't believe so.
Did you continue to treat the defendant, or did someone else either take over or?
I believe I may have given further medication at that point, but we kind of assisted each other in treatment at that time.
Can you describe the defendant's demeanor while she was in your care or in the care of Archbishop General Hospital?
Objection. Her demeanor is irrelevant. Actually, she's there for medical care.
Response.
Your Honor, I don't believe demeanor is ever irrelevant from whether she's there for medical care or not. That can be argued and inferred. The court can consider that.
Objection overruled. You may continue.
Is that-
Objection overruled. You may answer the question.
What was her demeanor like?
Initially, when I took her into triage, she seemed very uncomfortable. And then shortly after, she seemed to kind of start feeling a bit better after being in room 2 for a little while and had received some medications. So she appeared much better than when she first arrived.
Uncomfortable to start, then once interventions, medications, she seemed to get better.
Yes, ma'am.
Did you make any other observations about her?
Not that I can recall.
Was she there alone?
No, ma'am.
Who was she with, do you know?
She said it was her mother. Mother was with her.
All right, that's all the questions I have for you. I'll pass the case.
Mr. Mitchell.
Thank you, Your Honor. Sanchez, as I I understand it, she was admitted to Artesia General Hospital at the emergency room at 5 minutes after midnight. Is that correct?
I'm not sure. I'd have to look at the charting to know the exact time.
But best to your recollection, that's approximately correct.
It's asked and answered.
I'm sorry?
It was asked and answered.
I'll allow the question.
Go ahead.
I honestly do not know what time it was.
All right. You haven't examined any medical records?
No, sir.
So you're doing all this from your recollection?
Yes, sir.
All right. Well, is it true or untrue that when she was in the ER room, that at some point in time she was given medication?
Yes, sir.
Do you know if that medication was given via an IV?
I believe it was given IV, yes, sir.
Okay. And was that medication given at approximately 18 minutes after midnight?
I am not sure about the time, but shortly after her arrival, we would have given it.
Was the doctor on duty that night, Dr. Heather, and I don't know how she pronounces her last name, Vasquez?
Vasquez, yes, sir.
Is that the doctor that was the attending physician?
Yes, sir.
Do you recall, prior to receiving medication, if the attending physician ever came in and did any type of cursory examination?
Yes, sir. The doctor was present in the triage room before we moved her.
All right. So it would have been the doctor that ordered the medication?
Yes, sir.
I mean, you wouldn't have ordered the medication?
No, sir.
Not within your skill set?
Not within our scope, yeah.
Okay. So, do you recall that she received medication, sodium chloride, ketorolac, Zofran, morphine, sodium chloride, and at least that?
I would have to review the chart, but it sounds accurate.
All right. Most of those are pain medications, are they not?
2 of those are pain medications.
Okay. Now, were you present or did you attempt to get a UA?
I don't know who received a UA, but I know we did receive a UA. But
Did not?
I don't know if I received it or if another staff member collected it, but we did.
Okay. Did you also take a blood test?
Yes, sir.
I mean, you call in a phlebotomist and take blood?
I believe I would have drawn the blood at the same time I started the IV catheter.
Okay. And did you order a pregnancy exam?
I personally didn't order it. The physician would have ordered it.
But did you, at 28 minutes after midnight, get an order for it, collected at 30 minutes after midnight, send it to the lab at 31 minutes after midnight, and get a report back at 51 minutes after midnight?
I would have to look at the chart for the exact
But that
times.
sounds pretty classic, doesn't it?
The time frame doesn't sound off.
Okay. So let's talk about this pregnancy test, because the medical records in this case indicate that you received information that 51 minutes after midnight that she was in fact pregnant. Do you recall that?
I do not recall it, but usually the lab will call us for that positive test.
And that was before she ever went to the restroom.
I'm not sure of the time frame, but it could have been. I'd have to look at the time.
Now, you would not have told her she's pregnant. You would have given that information to the treating physician. Is that correct?
That's correct.
And would I be correct that from the time Artesia General Hospital found out that she was pregnant at approximately 12:51 in the morning, that it was 48 minutes before she went to the restroom?
I do not know the time frame of that.
Okay, but that's what the videotape and the medical records indicate. You wouldn't dispute that now, would you?
No, I wouldn't.
Would you agree with me that before she entered the bathroom, medication had been given to her through an IV?
Yes, sir.
Somebody had to help her unhook that IV.
Yes, sir.
She was complaining at that time, in order to get the IV unhooked, that she had to go to the restroom,
Yes, sir.
and that she was desperate to go to the restroom. In
I,
other words, she felt that she couldn't control it anymore.
I'm not sure if that was reported or not.
Okay. But at that time that the IV was being unhooked, the doctor had not come back in the 48 minutes and told her or indicated to her that she was in fact pregnant, had she?
I'm not sure.
Did anybody do an exam? Well, let me ask you this. The court has seen the videotape, and you can see part of the videotape. She was not in a hospital gown at the time she went to the restroom, was she?
No, sir.
She had not been placed on a hospital bed at that time, had she?
What's that, sir? I'm sorry.
Before she went to the restroom, she was still in civilian clothes.
She was still wearing her clothes, yes, sir.
Now, as I understand it, that means whatever period of time that was, that none of the nursing staff would have told her she's pregnant. You left that to the treating physician only. Is that correct?
That's correct, yes, sir.
And the treating physician, where was she during that 48 minutes?
I don't know. Probably, I'm assuming sitting at her designated desk, but I don't know where she was.
Well, wouldn't you, being a good RN, have noted and have alerted the doctor to the fact that you had a female of childbearing age in the emergency room complaining of abdominal pain and complaining of back pain, flank pain, that you had just got a pregnancy test back from the blood test that indicated she was pregnant? Would you have alerted the doctor to that?
Yes, sir.
Wouldn't she also receive the same information if you guys are in compliance with the Affordable Care Act and the computer systems you're supposed to have? Wouldn't you and the doctor simultaneously, since she's an emergency room physician, treating physician, have received that report from the lab?
I don't understand your question.
Well, after the Affordable Care Act, all these hospitals were required to have a computerized system so that we could transfer this information instantaneously to the people that needed to have it in the hospital. I assume Artesia General has that system in place.
Yes, sir. The lab report is also put into the system at the same time.
Right. And since the doctor should have received by 00:51, 51 minutes after midnight, the report that Alexee was pregnant, just as you received it. Is that correct?
On the system, correct.
Okay. Now, you've been in an emergency room nurse long enough to know that when you have a female that's pregnant and all of a sudden she feels the urge that maybe she has to go defecate, that may be something that you ought to check into to make sure she's not delivering a baby. Right? Classic symptom. Correct?
I did not know how far along she was, and she adamantly denied to me that she was sexually active.
Well, I appreciate it, but you had a test that you felt, I don't know what's causing that noise, that's me. You had a test that said that she was pregnant, a test that you put great reliability in. Is that correct?
That's correct.
Mr. Mitchell, I'm going to stop you here. Let's take a short five-minute recess here.
Oh, sure.
All right, let's make it about 5-10 minutes. Does anybody need a bathroom break or water break or anything? Okay. All right, we'll make it 5 minutes then. We'll reconvene in just a few moments. All right, we're back on record on D503PD 2023-00010, State of New Mexico versus Alexee Trevizo. Mr. Mitchell, you may continue.
Thank you. Now, we were talking about a symptom that because you knew at 12:51 that you had a test, blood test, that she was in fact positive pregnant. That you and the doctor both had, but yet she's allowed to go to the bathroom at 1:39 in the morning.
Yes, sir.
Now, knowing that she's pregnant, does Artesia General have an OB ward?
No, sir.
Does it have an OB wing?
No, sir.
Does it have anybody you call in case you have somebody that's pregnant in a hospital?
No, sir.
Sorry?
No, sir.
No, okay. However, the emergency room physicians are supposed to have some knowledge of how to deal with somebody that might be pregnant, correct?
Yes.
Okay. And one of the primary symptoms you have with a woman that's pregnant is if she feels that like she has to go to the bathroom, it may be that that's a pretty good idea that you check to make sure that she's not trying to deliver a baby rather than to have to go defecate. Is that correct? Does that make sense?
It's possible that, yeah.
Now, the medical records indicate in this case that you had that information for 48 minutes before she went to the restroom. The fact is, she was still in civilian clothes. Nobody had placed her in a gown appropriate for an examination, a pelvic examination, have you?
No, sir.
So, and that would routinely follow if you have somebody that's pregnant and you don't have the results back as to how close to date of delivery she may be, that perhaps further examination, physical examination is necessary, correct?
The doctor makes that call, though.
The doctor makes that call, not you.
Correct.
Correct. And since you were present prior to the time that Alexee went to the bathroom, no one from the doctor or you or other medical staff anywhere around that were there told her that she was in fact pregnant, did they?
I did not tell her she was pregnant.
You did not tell her? The doctor didn't come back and tell her?
That I know of, I don't believe so.
Well, you were
Prior
there.
to.
You were there the entire time.
No, I don't object. It's argumentative.
Well, I'm just refreshing his memory, Judge, to try to save us some time, but if the video shows that you were the one that was there, she was your patient, is that correct?
Correct, sir.
All right. Your Honor, at this time, I have no further questions. Thank you very much.
Thank you.
Thank you, Mr. Sanchez.
Anything further from the state?
Yes, sir. Mr. Sanchez, when you say that the Mr. Drops a bunch of questions about the defendant being pregnant, you knowing that she was pregnant, et cetera, when you testified that she adamantly denied being pregnant, what do you mean she adamantly denied?
It's one of our intake questions or triage questions we ask. I may not get the direct quote, but she said she had her period on time for the previous months. She says that she was always on time and that she just got off her period, I believe, or she had just had her period, is what she told me.
So she wasn't pregnant, she had her period on time for the previous months, just got off or barely enough.
Correct, I believe so.
Based on that, her statements and the other intake, at that point, did you have any reason to believe that she was pregnant?
No, ma'am.
Ms. Rizzo also asked you, 1251 is when this came and you had knowledge. When you get lab reports and results back, does the computer alert, a loud siren, flashing lights?
Computer? No. A lot of times the lab will call us with the positive pregnancy test.
Otherwise, you have to look for the results.
Correct. Yes.
Absolutely. Or actually, you may be released, John.
Any objection to this witness being released from subpoena,
None.
Mr. Mitchell?
That's fine, thank you.
Sir, you've been released from subpoena. What that basically means is you're no longer going to be called as a witness. You're free to go about your day.
Thank you.
Thank you.